Hi, I'm Dr. Jim Fox.
And I'm Dr. Janine Fox.
We are Doctors
Nutrition.
Yes,
Yep.
we are. We've got something hot off the press today, so to speak. It's the news. We like to bring these things to you because we really appreciate you joining us with these little short videos that we do, and here on YouTube, do whatever we do. But the big thing is we're trying to bring you the latest and greatest, so to speak. And this is what this is. Something that we've seen clinically. And just a second. I guess one of the big differences between us and a lot of other folks you may be looking at on the internet and so on, we still practice.
Yes.
So we see patients daily. And this is something that we've seen a lot of. It's about neurological conditions actually overtaking cardiovascular disease in the world stage.
Yeah, and they're actually, when they linked a lot of things together with neurological conditions. So, of course, all of them together is what they're saying is actually kind of surpassing cardiovascular. And what they looked at is stroke, dementia, neuropathies. They looked at migraine headaches as part of neurological, of course. They look, so it was a bunch of things together, but they're saying the whole nervous system and problems with the nervous system are hugely on the rise. And it was actually published in Lancet Neurology. So it was published in a peer-reviewed journal. The data that they used went up to 2021. So they're looking at data that was a couple of years ago, of course, because that's kind of what you see in most things that come out. The data is from a few years back.
It takes that time to
We've seen a huge increase in the last couple of years. So we know that we've talked about it ourselves when we come home at night. It's like, oh my gosh, everybody that comes in has dementia. Don't we? It really is something that we are seeing greatly. And so people need to start being aware. If your health is important and if you're watching this, it probably is. You want to start doing things early and don't wait till it gets to that point. Because in our opinion, we think a lot of the neurological problems are coming from environmental factors, stress factors. Of course, we always know diet.
Well, when you talk about the environmental factors,
that affects diet.
You're talking about the diet because that's a lot of the contaminants. We've talked about this before in other places. When you look at the actual number of chemicals, not food, but chemicals that they put in our food supply here in the United States, something over 10,000 different chemicals. It's not food. It's chemicals they use in the food for various reasons. Okay. That's the kind of stuff that, take one little piece of evidence and say, well, okay, if you consume this, really doesn't cause any problems. Okay, but let's consume it in 9,900 other pieces of data. Now, all of a sudden, we've got something that causes problems because we had that
put all the toxins together.
You lump all those toxins together, put them all in a big bowl and eat it, and what do you get? You get problems. And I promise you, daily, we get calls daily, either from usually it's a spouse or a child, person, and they're saying my dad or my mom's got this problem. They're starting to develop. They've just been diagnosed with dementia. They're having issues. What do we do? And so it's a common problem, and I'd say probably within the past 5 years, it has grown exponentially.
Yes. And they do know, I saw some other research that came out a week or two ago about COVID.
Yeah.
And they were talking about that if you've had COVID, if you had a severe case of COVID, it ages the brain up to 20 years. And then if you had a mild case of COVID, it could age it up to 9 years. And there are definitely things that you can do to actually, if you get COVID, to help that. And we've seen a lot, because we've seen a lot of the long COVID, and they're talking a lot about the long COVID and what that does to you. And that definitely affects the neurological system. And one thing, if you look at some of the research coming out, they're saying, the autonomic nervous system problems like POTS or dysautonomia is hugely on the rise since COVID hit. And so the nervous system and everybody is being affected.
Yep.
And so I always tell people, and then, they talk about the neuropathies. They link those with the nervous systems that's overtaken the cardiovascular. And we see tons of those, especially due to diabetes and prediabetes.
Right.
And what we see a lot too, people come in with neuropathies, and it's not diabetes or prediabetes. It's B12 deficiency. We are seeing so much B12 deficiency and folate deficiency. And we see nutrient deficiency as a whole. And the only way you know if you have those is to check it and know if you have it. So if it's not checked, you don't know. And that's kind of one of our approaches to all of this neurological issue is kind of know what your underlying problems are.
Right.
Know ahead of time and don't wait until you have a problem. And we have for years, we've been doing this, for 28 years. And we have always preached prevention. It is much easier to prevent a problem than it is to help a problem once you have it.
Yeah, you can't. It's a
now,
lot easier to
you
prevent
can still
correct.
help problems, but it is so much easier to prevent. And it's human nature not to want to do anything until you have a problem. That's kind of the way people are. I'm not sick. I'm not hurting. And then until they have a problem. And you don't know how many times I've heard from people, oh, I'm so healthy. And then they come back a year later and they have cancer. But they were so healthy.
We see that a lot.
Exactly. We see that a lot. So there's all these problems. So, we're talking about the neurological overtaking the cardiovascular, but just health as a whole has got to change. The path that it is going down is not good. And it's not that cardiovascular risk is going down is why it's overpassing it. It's just that everything else is going up. You still have just as much or more cardiovascular, but you are getting other problems across the board.
Yeah,
we're just seeing health issues as a whole. And stress, I think, is part of it too.
Oh, yeah. Think about it. Just watch the evening news.
Right.
That's pretty stressful. See what's going on around the world and so on, whether it's feast, famine, or whatever. Yeah. It's a mess. And then think about your daily life, inflation, et cetera, et cetera. And we constantly get the complaints about that, those kind of things. So all that plays on your health.
Yes.
And like I say, we see it daily because we still practice. We still see patients that come in with everyday problems. And these problems, we usually do the lab work. Like you said, you mentioned the B12 deficiency. We see huge amounts of B12 deficiency. And the bad thing is B12 deficiency leads to these neurological
problems.
Right,
exactly.
Right. So, and matter of fact, they've even shown that if you keep your B12 status above 800, that you actually slow down the aging of the brain. But who knows where yours is if you don't check it? And now we get a lot of people say, well, I get a B12 shot once a month. Geez, really? You need it a lot more often.
Yeah, it's water soluble. So when you get a shot, it's going to be out of you pretty quick. And so, if you have a B12 deficiency most of the month and you don't for a few days, it's still isn't quite enough to actually prevent the neurological problems. So, this is kind of our take on what we saw, but I was not surprised when I saw that article. I was like, man, this is what we've been saying is we keep seeing more and more. And like I said, it's not that we're seeing less cardiovascular. We're not. We're seeing more neurological and nervous system issues.
Right.
So that is a concern.
We're seeing a lot more of the cardiovascular stuff too. Don't get me wrong. That's a constant thing daily. We get the cardiovascular thing. But with this neurological stuff, and the bad thing about the neurological thing, and this is a horrible thing to say, but I'm going to tell it like it is. You don't want to wait till you've got these symptoms, and you don't want to ignore them. Because if you start having a little bit of a problem neurologically, let's just say that, okay, we forget where I put our keys. There's a sign. There's your sign right there. If you forgot where you put your keys, and you might want to think about this, this is time to start paying attention. Don't wait until you put the cat in the freezer, okay?
And we had that happen to somebody.
We had that happen. It's a long time ago. But anyhow, it did happen. And unfortunately for the cat, didn't make it. But that's the kind of thing that'll happen because if you deteriorate to that point, there is no turnaround.
It is hard. Yeah, it is harder. So
you're not going to turn that around.
Exactly.
And not from what we've seen.
Yeah. And I know there's a lot of people out there that say, oh, take this one supplement and it just reverses everything. That's probably not the truth. You can help. And there's certain conditions you can help. And yes, neuropathies we can actually reverse and help over time. And so if you do the right things. But on some of these dementias, they are very progressive in a lot of people. And that's what we are seeing because we see a lot of the people late. Kind of last resort. They've done everything, done all the medications, nothing's working, nothing's helped. Okay, now what can you do to completely turn this around? It's hard. I'm not going to lie to you. Now, if you come early, the people that come early, you can kind of halt it and you can keep it from progressing and you can help. But when it is all the way progressed, it is hard.
Yeah.
And
it really is.
It is. So I always say it's the people that don't think they have a problem that are probably more progressed than they think.
Yeah.
The ones that say, oh my gosh, I'm having a memory issue. I need something to help. they can be helped better because they still can recognize that they actually have a problem.
And we get those in daily. I mean,
we do. We get those in a lot. So we deal with a lot of those issues, and we're probably going to do a lot more videos on specific, areas and what you can do about it. Today, we just wanted to bring the attention that there are all these problems that are progressing. And I think that even that study showed there was an 18% increase in neurological and nervous system problems. And like I said, that linked a bunch of things together, but it's on the rise. And so people want to be aware of it and know that there's prevention that you can do if you know ahead of time. And, cortisol is one of the things that we check on every panel that we do. Yeah. And it is definitely, we've seen an increase in cortisol across the board.
Yeah, because it's stress. Mm-hmm. I mean, that is your stress response, typical
and stress response. Like they always said, stress can kill you. So stress is not good for health. And there are things, no doubt. We have a product, Cortisol Soothe, works great to lower the stress hormone. It really does. Sometimes we have to use a few things with it in somebody with an extreme response, but a lot of times that's all we need to use to actually help lower the cortisol. But, everybody's different. So we kind of take everybody individually.
One of the keys is my cortisol high or is my cortisol low? And everybody comes in and thinks, well, my cortisol's sky high. Might have been for a while, but not always. Because what we see, somebody's been under chronic stress for a long period of time. Yeah, their cortisol started out sky high. And over time, now it's crashed. Yep. And when they come in, they have about the same symptoms, really. Mm-hmm. They'll come in and they'll say, well, my cortisol is just sky high. It's off the charts. Let's test it and see. And okay, we'll check it. So we check their cortisol, and sure enough, it's extremely low. Yeah.
So we see both ways. That's why we always recommend checking it first. Yeah. And that way you can get the right thing for you for what you show.
Yeah.
And we've always said, if you don't know what you're dealing with, you really are just kind of guessing.
I always make an analogy to your car. You wouldn't just go out, raise the hood, and start pouring oil in without checking it, would you? But that's exactly what a lot of people do with various nutrients, whether you need it or not. They don't know, so they just start buying something and start taking it. That's not really a good approach. There's tests you can do to see, do I need vitamin D? Do I need B12? Because if you need B12, there's nothing going to
fix it. Is my cortisol high or low?
Exactly. You got to know. Mm-hmm. To see is to know, and not to see is just to guess. We don't like to guess about this thing. So that's why we stress doing the lab work to know where you are. You should be part of your yearly or bi-yearly routine to keep good health. So that's what we're here for. And we can do this pretty much in most places.
Most states, not all.
Most states, not all. But there's a few that won't. But needless to say, we've been doing this for 28 years.
Yeah, we've been doing it a long time.
We've watched these neurological conditions overtake the cardiovascular stuff now. Not that, like you said, not that cardiovascular is better. Right,
no, it's not.
It's actually worse too.
Exactly. It's like I feel all health conditions are probably progressing and getting more. The people as a whole, I think, are getting more health issues.
Right.
And I think the medical system as a whole is overwhelmed.
Totally.
And so people don't get as good a care because they can't get to everybody. There's too many problems. And so that's why prevention is what I think is the best way to go. Yeah. You try to help yourself before you get to that point. But if you're already at that point, it's not too late. You want to do what you can to make it better.
Yeah, all these neurological conditions are, and even some of the cardiovascular conditions are lumped under what we call chronic conditions. Chronic conditions are what really takes time in medicine. You go to your doc, and if you've got this chronic condition, they've got to take time to deal with you over a long period of time. It's not going to be just like an emergency room visit where, you've cut your finger, they'll sew it back up, you're on your way. This is a little different. These chronic conditions take a lot of time, a lot of resources, a lot of money, and that's the problem that we're running into today, because these people are with these chronic conditions like the neuropathies, cardiovascular disease, and they're just the system's overwhelmed, can't take care of them.
And I can say the healthiest people that we see are our long-term patients that came years ago and have done lab work every year. They fix what shows up on the lab work every year. They don't seem to get the problems everybody else gets.
Right.
So that's kind of what we stress and we think is the best approach to it. So we just wanted to let everybody know what was out there in the news and what our take on it was. And we'll get back with you for more things coming out in the news. We'll come out with more information and more things that you can do for different little problems.
Yeah. So if you like this video, go down there and click that like, and then subscribe if you're not already subscribed. Hit the little bell. You'll know when the next one's going to come up. Thank you again for watching Doctor's Nutrition, and have a healthy, happy life.